In clinical practice, what we commonly see, the sleep disorders we divide into two categories: the disorders related to sleep duration and the disorders related to behaviors during the sleep. The disorders related to sleep duration are insomnia and hypersomnia. The insomnia is most commonly seen in the clinical practice, which is rampant today, that is reduced sleep. So reduced sleep can be either difficulty in falling asleep or difficulty in maintaining sleep. This is insomnia. Now second category is hypersomnia, where there is excessive daytime sleepiness, which is relatively less common. Now second, sleep behavioral disorders like sleepwalking, sleep talking, nocturnal bedwetting, nocturnal leg muscle cramps, nightmares and night terrors. These disorders, they are common in different age groups and they may not directly come to psychiatrists. So broadly we see these kind of disorders of sleep. Yes, for assessment, the paramount importance is in history taking. So the history should be taken in detail from the informant, means whoever is accompanying the patient, who is associated closely with the patient, and from the patient. The main points what we include, since how long the problem is persistent. For example, 1-2 days of disturbed sleep is common for all of us in our stressful period. But a persistent problem in sleep, for example 3 days a week for almost 1 month, is something significant which need to be addressed. Second factor what we look for is any external stressor which the person is facing, for example job problems, health issues in the family, and extrinsic stressors. What we mean by extrinsic stressors means noise in the surrounding, or excessive light, or someone is ill in the family who requires constant supervision at night. And intrinsic factors like uncontrolled hyperthyroidism or some endocrine issues, or if some medicine patient is taking, we need to address. And most important, these days what we see are visiting the shift duty workers. So we ask in detail about their job profile, whether they have different shifts to visit, whether those are frequent travelers which cause a lot of sleep issues, and this is in length. If this doesn't serve the purpose, certain investigations depending on the patient profile, what we go for the thyroid profile, and depending on the underlying causes we order the investigations. And most important, that is what we say, the perfect investigation for sleep disorder is polysomnography, where it is the electronic graphical record of the sleep, where lot of recordings like EEG, ocular muscle recording, muscles recording of different body parts is done, and we can come to some conclusions. Look, there is not a certain protocol for treating the sleep disorders. It depends on the patient profile, and also depends on is there any underlying cause, because sleep is the overall reflection of the health. When sleep is affected, we need to find if there is something wrong in the body or mind which is causing the sleep to get affected. So we need to find out this first. Secondly, a general bunch of instructions, what we call sleep hygiene, is given to patient. These are the good sleeping habits which tend to improve the sleep-wake cycle, the overall sleep quality. So what includes in sleep hygiene is first that fix up a routine to go to bed and getting up in the morning time. Secondly, what we ask these people to maintain a routine, that what we say to maintain a rhythm, that not many changes in the routine. Some 1 or 2 times going to movie or dinner is quite acceptable, but overall maintenance of routine. Secondly, exercising in the daytime and not in the evening time is asked. Third, limiting the caffeine intake. So coffee should not be taken after 4 to 5 p.m. The smoking and alcohol should be done in moderation, less amount. And if this also is not helping, certain other instructions like a high tryptophan slack, glass full of milk before going to sleep is of something important. And a warm bath 2 hours prior to sleep also helps in getting the sleep. Most importantly, if the person is not getting sleep, even after lying down for 20 to 30 minutes, we just ask them to get up and going in some other room, doing some activities quietly till again he or she finds sleepy. If this doesn't help and this doesn't cure the problem, it is sincere request to visit your mental health care provider and not to take over-the-counter sleeping pills or sedatives which are addicting and damaging in long run. Visiting a mental health care provider can really cure your problem at detailed length, at proper time, and you may not require the sleeping pills for life.